Thinking back to these 19-year-old young women who may not have the knowledge to navigate institutions to the extent that you do, what kind of advice would you give them? What kind of support is in place for them to seek out?
Well, what I tell patients in general is the best thing you can be is an educated consumer. And medical societies have a lot of excellent patient education sites. And so, for instance, the American College of Obstetricians and Gynecologists has a women's healthcare site that has excellent FAQs, they have videos, they have all sorts of information. The American Society of Reproductive Medicine has that as well, and I'm sure a number of medical societies have that. So I always recommend to patients be educated about your medical issues. And also, I tell them, think about what you want to ask and write it down because there's a finite amount of time that the provider has, and you want to make sure that you get your most important questions answered.
I think that's great advice for most people seeking healthcare, actually. Thank you for that. You've already answered this question, but for the purpose of consistency again, did you apply for VA services for any service-connected disability?
Now, I looked into it, but I'm one of the few very, very fortunate people that didn't have service connected conditions. And so my understanding of it is you have to have a disability and to file for service connection in order to be seen in the VA. And so I think I was treated fairly, and I'm very blessed and fortunate to not have a service connected condition. So it never entered into my mind that I should be able to get services when there are many people who have a far greater need than I do. And as a retiree, um, I'm also covered by TRICARE. So,
What are some of the common challenges that you've witnessed other women veterans face while applying for service connection?
well, with gynecologic disorders, particularly if it's something that can't be objectively quantified. So, for instance, for service connection, let's say you have fibroids or you have endometriosis or whatever, the level of disability depends on the impact the condition has. And so often, and this is true not just of women veterans or active duty service women often aren't hurt. And so because of that, they may not be approved for the service connected condition, or they may be rated at a lower level um, because the provider who makes the determination didn't hear them or doesn't believe them or they don't have appropriate documentation. The other thing, getting back to your earlier question about what would you advise a 19-year-old, is that you should make sure that you are knowledgeable about your medical information. And it's important for you to make sure that that's documented in your medical record. So you might make the assumption that the information is there, and then when you try to adjudicate um, service connection, um, the information isn't there.